Hello, everyone. We're going to give a moment or two for people to come in. Thanks for joining us. Still got some folks coming in, so we're going to give a moment. Love that we have so many folks here. Lots of friends I see. Hello. Oh, Leora, haven't seen you in a while. Hello. Oh, Lucy. Hi, Lucy. Love to have students on. Hello. Sarah, hi. Great. We're going to give a moment for people to come on. Nice to see everyone. We'll give another moment. I know it's the middle of afternoon for folks. Give folks a minute to wrap some other things up. All right. Well, thank you, everyone. My name is Verna. I have the pleasure of knowing many of you on this call. And I'm always so appreciative of everyone joining these webinars. We work really hard to bring experts in from the field and around the country to be able to share information, answer questions, have really good discussions. And so similar or going in that vein, I would love to introduce now, it's my pleasure to introduce Jenny Mariaschin-Rudin, who actually has been a longtime colleague and friend and is an expert in the field. And I know that many of you have come to us and said, I'm not really sure how to manage individuals with ADHD in collaborative care. And I don't actually know if I really understand ADHD as well as I could. So we're super excited to be able to bring you today's webinar. And Jenny, I'm going to turn it over to you, and I will watch the chat for you and as you go.
Awesome. Thank you. Hi, everyone who I can't see. So I'm at a disadvantage there. And yes, I was recording that intro so I could send it to my mom. So just a few quick words about me so you know who's speaking to you. I am an LCSW in New York, currently in private practice. I've been a therapist for over 15 years. I stopped counting at 15. I used to work in behavioral health integration, also in Article 31. I am an ADHD clinical care specialty provider, also in autism. And I also specialize in anxiety, bipolar disorder, overwhelming emotions, and reproductive mental health. And what I say all of those things have in common is overwhelming emotions with a hint of rage. I am neurodivergent myself, neurospicy. And I was just telling people as we were getting ready for the presentation, I have ADHD. I promise, whether or not it's intentional, you will see ADHD happen in this presentation. I will make a mistake or catch something, and I'm going to know it's because there was a glitch in my executive functioning. I'm going to call it out, not as an excuse, but because I think it's helpful to learn as you go. I love puns, YA romantasy, along the lines of Twilight, spreadsheets, pizza, and lists, if you can't tell. I hate when I lose one earring, when I have tangled headphones, and when there are surprise raisins in my bagels and all baked goods. I also spent about 6,000 hours looking for good memes for this presentation, so hopefully you'll appreciate them. Okay, so I want to take a second and actually talk about what on earth is executive functioning. I think people talk about it a lot, don't always know what it means, so we're going to actually take more than a minute to talk about that. Fun fact, the term executive functioning was coined in the 70s when computers were starting to be a thing because, and I don't know all the technicalities of what computers did, but it's referring to the brain as the CEO of your body and of all of the things you have to organize. So that's why it's called executive functioning. The goals for today are simple. Understand what executive functioning refers to. Understand how co-occurring mental health conditions, depression, anxiety, etc., contribute to challenges in executive functioning, and identify one or two strategies for helping clients overcome a challenge in the collaborative care setting. 1 or 2. Why 1 or 2? People need so many. Well, setting a realistic goal is really important. I want you guys to have a sense of success. If I tell you I want you to learn 10 and implement 10, that first of all cannot happen. Secondly, that's setting myself up for failure. I don't want to do that. I call that out because when you are helping clients set goals, everybody knows this, but it is worth repeating time and time again. You want the goal to be manageable and realistic. Okay, so executive functioning refers to a series of skills, the skills that allow you to get things done. I can make a plan and I can follow through on a plan. I want you to put your thinking cap on and remember the last time you made a plan and followed through. It was just now when you decided you were going to attend the webinar and you showed up. You did it. Your executive functioning is working for you. Hooray. Sometimes it's not going to work for you. I planned to wear matching socks this morning and that did not happen. On a scale of 1 to 10, how focused are you? Banana. That's just a fun way of showing we don't always have high executive functioning. You can look at executive functioning in 3 core categories, and then we're going to break it down further. Don't worry if you don't get all of this. This is just a framework. Again, it's that series of skills that allows for you to get things done. There's working memory. I can keep information in my mind. I can use it as some way. Oh, I put my coffee cup here. That's not my coffee cup. I put my water cup here. I'm going to drink it. I remembered where I put it. I can use it. Obviously, that's going to be more relevant in a lot of other areas, but that's just one quick example. Cognitive flexibility, my absolute favorite one. The ability, Freudian slip, to think about something in more than one way. Cognitive flexibility is something that is super challenging, and it's really important for problem solving and for being able to think things through. Inhibitory control. When I was creating this PowerPoint originally, I was using British reference material, and so they say inhibitory control, but you can also think about it as impulse control. In this context, it's the ability to ignore distractions and resist temptation. So far, I'm talking about really broad categories. I'm going to keep moving. This is a beautiful slide. The colors don't have anything to do with each other, so ignore that. But now I'm going to talk really briefly about what each of these things are. As you're looking at this, I really hope you're thinking, what isn't executive functioning? Executive functioning is pretty much everything. So that's why it's so cool, because it's not just like, oh, I could do math and I could solve this problem. It's everything under the sun. You can talk about it with your toddler. You could talk about it with your senior. Like it's relevant to absolutely everybody. These are the skills that are impacted when there are challenges in executive functioning. Impulse control. I can stop and think before I act. Can I? Last night I couldn't because I ate that bag of pretzels because they were so delicious and I was only going to have one, but they had honey mustard. I couldn't stop myself. Organization. I can keep track of information and tasks. Okay, I can pretty much do that. As long as it's not something absolutely essential that I need to survive, like my phone, I can do that. Emotion control. My ability to manage my emotions to direct my behavior. So that's a key and subtle difference, which is I can be sad, but I can function anyway. That's good executive functioning. I can be sad or anxious. I can't move past it. My anxiety is completely overwhelming me. I don't have emotional control or emotion regulation. That is a problem. Task initiation. I can start tasks. One of the most common things people come to me with is, I know what I have to do, I can't do it. Planning and prioritizing. I can plan steps to reach my goal. So I can set a goal and I can plan what I have to do to reach my goal. I can get up and go get a glass of water. I'm going to stand up. I'm going to go to the kitchen and I'm going to turn the faucet on and do it. Great. So easy, but make it more complicated. I probably can't. Self-monitoring. I'm going to say this is not just evaluating your own behavior, but you're evaluating your emotions as well. You're monitoring how you're feeling, how you're doing. I'm also going to add that monitoring how much time has passed, which I have not been doing, is also really important. A lot of people fun little thing with ADHD, have something called time blindness, where we have no idea how much time has passed after we've done something. So I could be rabbit holing on some sort of fun topic, like, you know, all the stars in Outlander and the spinoffs, and then whoever's in that spinoff for like 45 minutes. And I'll tell you, oh no, I've just been doing this for 10 minutes, 5 minutes. Attention control. I can focus. I know I need to focus on something. I'm going to do it. When you have a challenge in this area, you can't focus. Working memory is that ability to, again, hold something in your head in order to complete the task. So I'm just going to pause and ask you for a second. And you don't have to, I mean, you can't answer anyway because I can't see it. But if you could choose one that, like, if I could just do this, it would change my life, what would you pick? 2 seconds to think about it. 1 second to think about it. Okay. I did this and I do this. I lead workshops for clients on a regular basis. And the most recent one, everybody said impulse control, which I thought was great. I would say all of them. I can't possibly answer that question. So for me, it's a trick question that I designed myself. But impulse control, because think about how great your life would be if you just didn't do anything that you shouldn't do because you were able to stop yourself. A lot of these overlap as well. Sometimes you'll find you can't initiate a task because you're not organized well enough, or because you have poor emotional control, you're overwhelmed, or that's why you're having a hard time self-monitoring, or why you can't focus. Or you have poor impulse control because you were so upset about something that you threw your phone, right? Those are two things happening at the same time. The most important thing is to figure out why. So I go through these step by step with a bunch of examples because I think it's easy for me to rattle off a list, but I want it to be easy for you when you're talking to clients. So impulse control, the ability to stop and think before you act. And please stop and think about how perfect that little picture is. I don't know that child. Example, I'm working, I get a little bored, my hand reaches to scroll the phone, but I stop myself and I focus on my work. Is that a true story? Sometimes. Example of a challenge. Before I can stop myself, I'm reaching for my phone and I'm scrolling away. Woohoo! I see all these fun things. Or not, maybe I'm doom scrolling. Emotion, fun fact, that is my child when she was a baby. Definition, ability to manage your emotions, to direct your behavior. Again, that's emotion control. She still doesn't always have the greatest emotion control. Example, I start to get overwhelmed by anxiety, but I take some deep breaths to regulate and I center my focus on what I'm doing. But a challenge would look like I am so overwhelmed by anxiety that I have a panic attack and can no longer go about my work. It doesn't have to be that extreme, but it can be. Organization. If anybody has a desk that looks like this, you are my people. Ability to keep track of information and tasks, and also objects and things. Everything. There's a place, example, there's a place for everything and everything is in its place. Or I can write an email or a note or a memo with a clear beginning, middle, and end without the assistance of ChatGPT or anything like that. I could do it. Everything's in order in my head. Example of a challenge is my desk is extremely cluttered. I cannot find anything. Or my thoughts are all over the place when I'm writing my email and memo, or even when I'm talking. And as I'm going through this, I want you to think about, you could think about yourself, if that's a good example. You could think about a client or two, or even a person in your life. Or if you want a character in a comic book or a favorite TV show or a movie, it doesn't matter. Just try to apply this, if you can, to somebody in your head so it can be more tangible and real. It's a good way to stick information to something. Task initiation. The ability to start tasks. Example, I need to start cleaning my bedroom, so I begin by making the bed. That is not a true story pretty much ever in my life. Example of a challenge. I need to start cleaning my bedroom, but I get stuck and overwhelmed. I'm just going to keep watching TV instead. You want to keep out for a bunch of different contributing factors to issues with task initiation. anxiety, depression, overwhelm, or even problems, like I mentioned earlier, with other executive functions can really impair task initiation, or just plain old distraction, or say you have another life barrier, you broke your ankle or something like that. This is a really big one. Also, I really like this song. Okay. Planning and prioritizing. If anybody remembers Elizabeth Warren and wants to have a moment of wishful thinking, go for it. Ability to plan steps to reach goals. That's critical. And also to prioritize. This is more important than that, or they're both important. How will I do all of those things at the same time? I set a goal for myself on how many case notes I want to write by a specific time. I set aside time to do it, and I'm able to put off other tasks that can get in the way because that is my plan. True story now, after years of practice. Example of a challenge. I cannot think of a clear goal besides get them done. I don't designate when I will do it, and they slide by, and competing priorities get in the way, or even distractions. Working memory. If anybody knows who this is, hooray. Ability to hold information in your mind to complete tasks, like following directions, remembering a phone number. I went to an ADHD conference, which was like one of the best experiences ever, back in November. And Penn Holderness, the Christmas Jammies guy, he's now an ADHD spokesperson. He wrote the book ADHD is Awesome. I fully recommend it just for fun and for kicks. You can YouTube look him up later. He said people with ADHD, or he himself, has a really hard time with working memory, except for like really critical things like the number for the pizza place from when he was in his 20s. And I'm like, oh my God, 212-472-1200. That's the pizza place from when I was an adolescent. I'm 41 years old, 472-1200. And they're still in business, believe it or not. Let me a pizza if you're ever in New York City. So I thought that was hilarious. You can have excellent long-term memory, but that working memory when you really need it could totally fail you. An example of a challenge, forgetting what you're doing as you're supposed to be doing it. What did I come into this room for? Forgetting where you put your car keys, your cell phone, etc. My funny little anecdote with this is, so I mentioned I have this daughter. She's 4.5. When she was 3.5, we left the apartment, as one does, and we were at the elevator, and she looks at me and she goes, "Hey, mommy, you didn't forget your phone." I'm just like, oh gosh, it's like such a rare occurrence that I wouldn't spend 20 minutes looking for it, that she knew. My working memory is not so fabulous. Focus. Ability to regulate and direct your attention and focus. I'm not yelling at you to focus, but if you can't focus, focus. Studying for an exam, listening to somebody while they're talking, reading, even writing an essay are things that require focus. Examples of challenges. I get a text and I answer it, and I can't redirect my focus back to my task. Or I randomly start thinking of something I'm anxious about and I can't focus. Focus can also look like a dissociative episode. Lack of focus can look like a dissociative episode, or just zoning out. Difficulty concentrating is a key symptom, I should have made this a pop quiz, of depression. It's even one of the questions on the famous PHQ-9. So it's everywhere. Executive functioning is everywhere. It's across diagnosis. It's going to show up in depression. It's going to show up in ADHD. But I love this one because I think people often forget that difficulty concentrating can really show up in depression as well as ADHD. Also, it shows up in ADHD, and imagine if you have both. Self-monitoring, ability to evaluate your own behavior, and like I said, your own mood, emotion, and how that interacts with your behavior, and ability to get things done. An example would be, I know how much work I've completed and how much I have to get done. I can gauge the quality of my work. I can tell how things make me feel or how my actions impact others. In other words, I am a wonderful human being and I know it. Barriers would be, I'm rushing through my work. I can't really think about how I'm doing, or I'm preoccupied with life stressors or temporary distractions, or I have a lack of overall self-awareness and insight. which isn't to say I'm a terrible person. It's just like, I've got a lot of things going on. Other mental health conditions can also impair this. Or you could be a cat chewing a camera. Of course I know what I'm doing. Okay, so these are the executive functioning skills. I'm going to make everyone really dizzy for a second and rewind time. This is the slide. If you want for a second, just right now, to take a screenshot of this or to take a picture with your phone, that's totally fine by me. I'm going to count to 5 and do that. 1, 2, 3, 4, 5. You will definitely get copies of these slides later. But right now, if you want that, I just want you to have it. Okay. Great. How do challenges in executive functioning affect a person's ability to take care of themselves, interact with others, and their overall mental health? If anybody wants to answer, this is a good time for me to take a sip of coffee and for you to pop it in the chat and someone to read out loud. But if you don't want to answer, I love my own voice and I'm happy to do that after said sip of coffee. No takers. Okay. Well,
nothing in the chat yet.
Nothing in the chat.
Oh wait, one, we did get one. Burnout.
Awesome. Someone said
burnout.
Burnout? Yeah. Is that what I heard? Okay, awesome. Yeah, burnout, totally. There actually is such a thing called ADHD burnout, which can make somebody, you have like spurts of energy, you could do it, or you're so tired of having to keep all of your executive functionings in line, you just completely burn out, you get exhausted. It's harder to take care of yourself. It can be, think about that impulse control and emotional regulation as you're interacting with others. And also with mental health, if you're not getting things done, your self-esteem takes a real hit. You're going to see, especially in women, anxiety and ADHD like this. They go hand in hand a lot of the time, and also depression, right? I see people a lot who I have a colleague who jokes they come for the ADHD, but they stay for the anxiety. And then of course, anxiety makes it harder to deal with executive functioning, so it spirals. Okay, so you're stressing, you're overthinking, and you're overwhelmed with life. Aw, poor kitty, poor Puss in Boots. So I say this as like, oh, hello? Oh, okay. So I say this a lot. I don't think you've heard me say it yet. So me being a broken record, I'll just put it out there. The best way to inform interventions, and this isn't just with executive functioning, it is especially true though, and I'll say why in a second with executive functioning, is to understand not only what is happening, but why. Because if you don't know the underlying reason or contributing factor with impulse control or lack of focus or task initiation or any of the executive functions, you can't really figure out what you're targeting. I know that I don't think I have to say this, but you would be really surprised at how many people take symptoms as base value. So if a client says, what can I do about task initiation? I will never say to them, here's what you can do about, okay, I have said that. Here's what you could do because I'm excited. But then I'll say, wait. Why are you having a hard time with task initiation? So, and I have a million questions about that. So, pop quiz. Everybody pay good attention. It's hard for me to listen when people talk for a long time. My mind wanders and I think about a million other things I have to do. I feel overwhelmed and I feel bad about myself because I can never seem to get anything done. It's hard for me to retain enough information to do even the most basic tasks. This is impacting my ability to take care, oops, typo, annoying, to take care of myself and get basic tasks done, and is even impacting my relationships. Is it anxiety? Is it ADHD? Is it depression? Is it bipolar disorder, PTSD, borderline personality disorder, or autism spectrum? I say disorder, but I don't like that term for it, or autism. Think hard. Your entire life rests on the answer. But it was a trick question all along. It was all of them. It was all of the diagnoses. Executive functioning is absolutely related to everything, and it really depends on what else is going on. How holistic is your assessment? What questions are you asking? Are you asking about the PHQ-9? Are you asking about anxiety? Are you looking at interpersonal functioning? Are you getting a good history? If you are not, you're not going to be able to figure out what's going on. It is not always ADHD. In your context, when you're working with people who already have ADHD, it doesn't mean it isn't also one of those other things. So now we're going to talk about what are the actual contributing factors and how. Neurodevelopmental disorders or conditions, autism, ADHD, learning disabilities. You have mental health conditions, mood disorders, anxiety disorders, bipolar disorder, and depression. I don't know why I listed those separate from mood disorders. PTSD. Psychosocial stressors such as life circumstances or structural barriers. Structural barriers, I mean systems-wide. And I will not say my side comment there, but I'm thinking it. Physical or physiological state, fatigue, hunger, illness, or even just acute pain. Okay, so neurodivergence and neurodevelopmental disorders. Neurodivergence is, you could do a whole semester of classes on this, or even a whole grad degree, but just in a nutshell, people whose brain interacts with and experiences the world in ways that differ from others, meaning the neurotypical or the so-called norm, and it includes but is not exclusive to the following neurodevelopmental disorders. Common examples are autism, ADHD, and learning disabilities. Holistic interventions are occupational therapy, cognitive therapy, medication, learning specialists, etc. I'm going to fly through these because I don't think we need to focus on this right now. I just want you to be aware that when you're targeting executive functioning, you can't just look at like therapy or medication. There's a lot of different things you can do. Mental health conditions, you guys know what that is. I don't have to say it. But I do want to highlight about problem-solving therapy. Problem-solving therapy, I have to say, way back in the day when I was learning this, I was like, I don't like this. I didn't go to graduate school to learn problem-solving therapy. It's so boring. And now it's just like, I love it. My clients love it. It is fabulous for ADHD in so many different ways. It's even called chunking in ADHD. I'm like, you fools, you're talking about chunking, but it's problem-solving therapy. We are literally partializing problems. It is extremely effective. You want to learn problem-solving therapy inside out. It's going to help you in every area of your life. If you're skeptical, talk to me after. I will tell you, it's super helpful. So I highlight that because I just want to put a plug for that for everything. Okay. Psychosocial stressors. If you don't know Maslow's hierarchy of needs, I will say certain things have to be addressed first before you can think about mental health or even executive functioning challenges. This is concrete things. Like if somebody isn't eating enough or they don't have money for food or they have unstable housing, you want to also help with that or connect them to help with that because it's going to be a lot harder for them to be able to solve a problem when they have a million things going on. Again, problem-solving therapy can help. If you're overwhelmed, good. Means that you're taking some of this in. Remember, all you need to do is learn one strategy, which we haven't even gotten to. All right, physiological state, the condition of something going on with your body. I don't know. I actually want you to think about the last time you were hangry or the last time, and if the H didn't come through, it's hangry, or the last time you were just really tired and couldn't pay attention. It's 2:30 in the afternoon. I would not blame you if that's where you were right now. Or just like waking up in the morning. My husband has a fabulous, that is sarcasm, tendency that right when I am waking up, he likes to overload me with logistics because he gets up a couple hours earlier than I do. I shout invectives. It's our beautiful morning ritual. I can't be held responsible for remembering anything when I'm that exhausted. And neither can your clients probably. Okay, so what's actually getting in the way? Once you've looked at like, okay, are there larger contributing factors? You then want to take a look at what actually happens when an executive function malfunctions. What am I talking about? That's a lot of words saying nothing, or saying a lot. So it's taking a look step by step. When you try to write a paper, when you try to pay a bill, what exactly happens? I was doing this, I do this all day, or I do this every day. And I was talking to a client and she was like, I can't get out of bed in the morning to even like think about going to class, let alone completing an assignment. What's the first problem for her? It's too cold. Okay, let's take a look at that. What can we do? Well, I don't even think about my sweater because I'm too tired. Okay, can you maybe get your sweater out ahead of time at night? Is that going to be the first thing you can do? Well, I'm really overwhelmed by getting to class. That's because getting to class is a huge, big thing. Can we chunk it? Can we partialize it? Problem solving therapy. Okay, enough of that. So everybody take a moment to appreciate Moana. And if you have bad things to say about it, I can't hear you anyway. Okay, you want to ask, what is wrong with me? Nothing's wrong with you. You just have issues with executive functioning. So I want to look at this in two ways, because when you're talking to a client, you don't just want to talk about all the deficits. That's going to make them feel like a piece of garbage. I was talking about deficits a lot with a client this morning. And then I'm like, oops, let's talk about some of the things that are going well. So you want to ask, what are the tasks that are the most difficult to accomplish, but also what doesn't take a lot of effort, right? So I know for myself, like what's really difficult to accomplish, cleaning. It's a fantastic example for me. And I could tell you, I could wax poetic on why for a long time. It's not a priority. But also it is a priority because we have to have people over for play dates, and man, did that get me into shape. But what takes the least effort for me to accomplish? I don't know. I really love making PowerPoints. I don't mind writing case notes. God bless me for that. And what happens in my brain and body when I try to accomplish a challenging task? I'll tell you, all of that. That's what happens in my brain. That's what happens in my body. This like, and then what about when I'm thriving? It's like, okay, I'm up. I could do it. I'm excited. I feel good. What's the most challenging time of year, week, or day? A lot of people with executive functioning issues, and this isn't true for everybody, but especially with ADHD, do best in the morning. Again, not always true, and not always true, especially if they're already on medication or self-medicating with caffeine or something like that. That's when it's easiest. Most challenging might be 3 o'clock. I'm done. I don't want to do this anymore. I'm exhausted. Or for me, it was always like after lunch until I discovered maybe don't have carbs only for lunch, and then things would be a little bit better. Where am I when it's the most difficult? What's going on in my surroundings? Is it busy? Is it loud? Does that stuff not matter to me? What environment actually, on the flip side, sets me up for success? People say a clean desk does wonders for someone. Well, I'll never know because I've never had one. How do I feel emotionally when I'm experiencing a barrier to task accomplishment? So it might be like, well, I don't feel great. I'm really upset, or I'm really down, and that creates the barrier. Or in response to the barrier, I have no regulation. When I'm thriving, I feel pretty good, excited. Maybe that doesn't actually matter at all. When I'm accomplishing things, it's not my emotions. You don't know. Got to ask the questions. What's going on in my life when I'm blocked? Again, you don't know, but it could be, well, I was working, somebody who came to my groups, he was getting engaged and started a new job. And it's like, great, those are exciting things. He's like, he should be crushing it. He should not be crushing it. He's got 2 new big life adjustments at the same time. So the engagement, he had to write his spiel. What's the spiel called? Your vows. He had to write his vows. And what's going on in your life when you're thriving? Well, maybe nothing, right? Maybe you're in between jobs and you're like, but I'm getting everything else done. Great. Okay. Whew. So we did assessment. We talked about Moana, not for that long because I didn't go on a hyper-focused tangent. So we're doing great. Now we're at the fun part. By the way, it's all the fun part. ADHD is so fun because you can really help people concretely with tools and strategies. Somebody came to me yesterday. It was actually a friend. I had to reach back and remember. It was only last night, not even 12 hours ago. No more than that. I digress. So ADHD, it's happening. And she said, I need tools. I'm like, okay, Tools is a meaningless term for me. I know everybody loves that term. I don't know if you mean medication, strategies, very specific skills. And she admitted to me she has no idea what she's talking about. So tools are strategies. So I'm not going to do my Yoda impression. Everybody has one. Do your own if you want. I don't even know if this is a real thing, but I love the meme. Patience you must have, worth it will be. So it's really important. The reason I put that out there is I want to manage your expectations. You want to manage the expectations of your patients, clients, members, whatever term you use. I had a client on Friday who was like, I just need systems in place as soon as possible. And I'm like, great, you will get them, but not as soon as possible. Part of why you do this is you want people to not only to feel successful, you actually want them to be successful. Being successful means trying. Trying means failing. It's just inevitable. It's the way of things. If somebody really does really great with a strategy one time, great. But how many times have you given a client a strategy or behavioral activation or something and they're like, well, that didn't work, I'm not doing it again. Expect that it's not going to work. Telling someone with ADHD to have patience is like a ridiculous thing. So don't use the word have patience, right? That's like telling an angry person to calm down. No, thank you. You just want to let them know, please try this at least, I would say 14 times before you expect it to work, or 7 times, or better yet, ask them, we're going to choose a strategy and a plan. How many times do you think you should try it before deciding if it works? Then if they give you some ridiculous answer like 1 time, then negotiate with them. But most people they'll understand. Okay. So how else do you set clients up for success? I guess all of these are number 1. Fabulous, Jenny. Take time to thoroughly assess what is going on before creating a plan. Do you remember when I said earlier about being a broken record? You have to assess, because if you don't assess, you are missing the whole story and you're not going to be able to come up with the proper intervention. So take your time on this as much as is possible within the confines of collaborative care. But really, assessment is also not a one-time thing. It's an ongoing thing. How was that for you? How is it going right now? How do you feel about it? Do you understand it? Can you repeat it back to me to make sure I said that clearly? I always do that because it's not about them not focusing or listening. They're going to think that. That's their bias from a lifetime of ADHD, diagnosed or undiagnosed. But so I have to make sure I said that clearly. You want to have a client pick 1 or 2 strategies to try at a time. You want to manage expectations. You want to make sure they try the strategies for 3 to 4 weeks, check in with them to see how they're doing, and that they're really trying. Not that they're like, oh, I said I would do it, but I didn't do it. Barriers are good. Barriers are not bad. They're your friend. You want to explore them with your clients and leverage them as opportunities to build rapport, learn, tweak the plan. Just this morning, I was talking to someone, probably one of the same people I referenced, who said, oh, the reason I didn't do my 15 minutes of checking emails was because, I had to prepare for my presentation, which I hadn't prepared for. I'm like, say what? You hadn't prepared? That's a barrier? Like, let's talk about that. Why didn't you prepare? And like, let's go down that rabbit hole. But also, you still have to do your 15 minutes. So barriers are great to explore. They are not resistance. They are real. They are opportunities. They are gifts. And within reason, as long as you're not making it all about you, don't be afraid of disclosing your own executive functioning barriers. I think, we all have different leeway for this in different scenarios, but I find clients really appreciate, and I'm pretty free with language, I won't be here, but clients really appreciate when what's a good synonym? When I share with them my shenanigans and tomfoolery, right? When I'm like, yeah, I woke up this morning, I had grand plans of, I don't know, cleaning my room or reading my workbook and preparing for my sessions. And instead I spent, this is actually true, I spent 45 minutes organizing a book swap party for March 9th on a Sunday and making sure everyone I know is invited so I can get rid of all of our used books. Did I need to do that? I had a lot of other things to do, but that's what happened. So clients enjoy hearing that type of thing. It can undermine shame and stigma for them. as long as they respect you and you don't waste too much time with your stories of shenanigans and tomfoolery. Okay. Ignore the things that say which appendix is what. I apologize. I added some appendices and then reorganized them, but there's a bunch of stuff at the end of this that I will give you a peek at. All right. Okay, I'm looking at my time and I know we only have about 20 minutes left. I want to leave time for questions. I'm going to fly by these. Instead of reading you all of the things on each of these, I'm going to only do one or two. Planning and organizing, setting SMART goals. If the goal is vague, nebulous, inappropriate, too big, it's not going to work. So you want to make sure that if a client has a task they need to accomplish, that they know exactly what it is they need to do. 2, break that task down into smaller parts. Why am I highlighting that? Does this sound familiar? Problem solving. It's problem solving. You know how to do this. It's chunking. So it doesn't necessarily have to be in the perfect order. But like I said, with my getting out of bed patient, what's the first thing you do when you have to get out of bed in the morning? You open your eyes. The next thing you have to do is you sit up. Then you take the covers off. This can be really helpful. You don't always have to do it in that small of a way. People often think, well, that's really, I'm going to baby the client. That's infantilizing. I don't want to do that. No, like they need that. And you can say to them in advance, if you feel like this is too small, let me know. I want your feedback because this is a partnership. We're going to come up with this together. Strategies for task initiation, a clear goal for that specific moment and doing the easiest, smallest part first. Somebody said to me, I have a really hard time even going to the hardware store to pick out what I need to pick out. And I said, stop it. You had me at hardware store. What's the first thing you need to do? And that is really critical. And she was like, I don't even know. I'm like, you probably want to put your shoes on, right? Isn't that the first thing you need to do? After that, once you get, then it's like, well, okay, the problem starts when I get to the hardware store. Do you know what you need to get? I do know what I need to get. Okay, then what? I don't know where to find it. Okay, so then go ask the person who's at the hardware store, where do I find this? And really taking them through step by step. Then you want to analyze after the fact, how did this go, etc. Also accepting, I know I said I would do 2, but this is critical. Accepting discomfort. People with ADHD who I work with, time and time again surprise me. And if it's time and again, I don't know why it always surprises me. When they say the most helpful thing is to accept discomfort. Don't wait for that right moment, right? It's similar to behavioral activation. You don't want to wait for the energy or wait for the depression to lift or wait for the, oh no, I've got this now. You want to do it anyway. And you want to accept this is going to be annoying. I'm not going to like this. I'm going to do it anyway. There's other strategies for task initiation. Again, use this as you want. Feel free. Like this is your toolkit. Once you have the PowerPoint, you can experiment with different ones. A lot of these are self-explanatory. Emotion control, take breaks, deep breathing, mindfulness, positive self-talk, progressive muscle relaxation. All of these things are great. They also help with focus. So this is critical. Taking breaks is key because you don't allow that time to like the time for everything to build up in you. Impulse control. So when you start to notice, and this goes back to self-monitoring, you want to stop, pause, think about what you're doing, redirect yourself. Sometimes you can even count to 5. With kids, I ask this question, like, and people love it. I like it too. What if you had a time machine to go back and press freeze for 10 seconds? Would you do it during your day? What trouble could it have gotten you out of? And people were like, yeah, I definitely wouldn't have hit that kid. Or like, yeah, I wouldn't have even opened the bag of chips or whatever it is. And mindfulness, of course, is always helpful. And mindfulness can mean a lot of different things. So I'm going to just say I'm not going to go into that now, but another time if you want. And also you can reference the slide at the back. Strategies for attention control. Mindfulness, way to go for me for not spending enough time on that. If you notice your thoughts drifting, don't judge yourself. Also having a focus mantra, even just being able to say focus, focus, or I say, I'm doing this now. This is what I'm doing now. Oh, I'm writing my note now, or I'm thinking about Julie now, or etc. You also want to have, and this is also really helpful for anxiety, when you start to get distracted, like you can have a notepad or even on your phone, if that's not a gateway drug. You can write down what your extraneous thoughts are. This can be really helpful. You want to set timers to check in with yourself, take breaks for self-monitoring, for being able to evaluate your behavior. How am I doing? You can also use a mood check, just say like, how much energy do I have? How pleasant do I feel? By self-monitoring, you can then make adjustments as needed. Working memory. So this doesn't always improve your memory. Sometimes you have to outsource it. I rely on checklists. Ironically, people with ADHD might keep a million checklists and then lose them. That's okay. So then maybe keep it on their phone. I had someone say, I can't keep it on my phone. If I go on my phone, I'm going to get distracted by a million things. I'm like, so then don't. Let's work on that instead. Remember, barriers are foes or friends. Oh yeah, I won't be able to hear you. They're friends. Barriers are your friends. So checklists, routines, trying to have a structure in mind, keeping things visual on the wall, really helpful, especially for kids. Different ways to remember information. I still remember the Bill of Rights song that I did in 7th grade because that's the only way I would remember it. And visualization, even being able to say like, I'm going to close my eyes. Where did I put my phone? Actually, I have no idea where I put my phone. Oh, right here. Okay. And to avoid multitasking. Okay, so, pause for processing after information input. That was a lot of information. I will just, before I go back to questions and answers, I will say I have a lot of appendices here to further go into some of the stuff I mentioned. So I've got SMART goals. I have 2 different ways to prioritize. There's also something I want to just give a little bit of language to. When people have ADHD, it can help for them to think back on why they're doing what they're doing and going back to their values. So if you have a task, and I go back to mine with cleaning, I really don't like cleaning. Cleaning to me is, I'm like, it's a remnant of capitalism and the patriarchy, and I'm just not comfortable with the paradigm that I should have to be the one cleaning in my house, right? Like I can say all of that. Is that going to help me? No. What is my priority? My daughter having an active social life, especially given her autism. The play dates are incredibly important. That's really deeply important to me. The winter, I don't like going outside. She needs to have play dates. Play dates cannot happen in the cesspool of disgustingness that is often my home. So when I'm cleaning, I need to remember my priority is my daughter. That's really important, not sticking it to the man. Although in all due time. So having people talk about their priorities can be really helpful. Chunking again is really important. I'm going to stop there because again, it's a lot. What are people's questions?
Thank you so much. That was
a lot.
Yeah. And so there was a couple of questions that came in. So 2 questions. One I thought was interesting, and I've wondered this myself a little bit, is some people describe having like professional ADHD and like developing these qualities because of like work as opposed to them. And so someone wondering if you could comment on that. The other was, in addition to problem solving treatment, what very specific strategies could I employ with my patients that would be helpful in sessions, i.e. shorter contexts, so that was the question.
What is shorter context?
Meaning like in collaborative care, like a session, right? Like, so a shorter time on the phone with someone maybe is what they mean. Yeah.
Awesome. I'm going to do the first question first. So it's interesting about professional ADHD or like context specific ADHD. In reality, you're going to get a whole other presentation on ADHD and diagnosing it. But I am going to answer because it's such a great question. ADHD criteria isn't looking at your overall life as a whole. It's looking at, I mean, it is, but it's specifically looking at unpleasant tasks. So not to say like if you have ADHD at work, it means that work is unpleasant and you hate your job. It's not that. It's looking at, can I focus when it's something I don't like? Can I focus when it's something I do like? Probably. I don't know. I read Harry Potter like in a minute. Like I read the 7th book in a weekend, and that was nothing to me. But if you ask me to read a textbook on psych stats, like I would rather do a lot of miserable things. So when people get ADHD or have like adjustment with ADHD, it's usually that the context is bringing about a lack of focus or a lack of ability to get things done. It can also be that they were never diagnosed as a kid, already had ADHD. ADHD is a neurodevelopmental condition, which means that technically, according to DSM, you can't get ADHD as an adult. You have to have presented with symptoms as a kid. That doesn't mean everybody knew they had symptoms as a kid. It just means looking back, there should be some evidence that that existed. However, there could be exceptions. Like I have a client who was homeschooled, so it didn't necessarily come up, but then it started to emerge once she was in a more structured environment as she was getting older. So I think, I don't know if that answers the question, but it is a good one. The second question I already forgot because my working memory is impaired. What was it?
So what are some very specific suggestions for in treatment, i.e. should we have shorter time scheduled with individuals?
Oh, like in the actual session itself?
Yeah, like shorter, like in collaborative care, a lot of it is telephone. So should I have shorter telephone conversations? Should I, like, are there very concrete suggestions?
How, I get it. Like, how can you specifically use executive functioning support to communicate with your clients within the context of a telehealth session?
Yeah.
Okay, that's a very thoughtful question, whoever asked that. So I would say if you're dealing with somebody working, I shouldn't say dealing with, if you're talking to someone with executive functioning challenges, depending on what's going on with them, you want to, using real-time intervention is really important. I don't think a shorter session is necessary, but you don't want to talk as fast as I just did, trying to get as much information in as possible. Less is more. So you don't want to have too much covered at the same time. You want to make sure that you are asking them to repeat back to you what you said. I know I said that earlier, but checking for understanding it's important in any, not just for ADHD or executive functioning, but in general, you want to check for understanding so that you're on the same page. Also, by repeating back, you're going to find someone missed something, or it helps instill in them in their own words what they need to do. You want to ask them in the session, how are you going to remember this? Are you writing this down? Do you want to put this in your phone? Do you want to type this as we're talking? You want to leave a few minutes at the end of the session. I would say like at least 2 or 3, so that the person can create their action plan, which hopefully you're already doing. It is not your action plan, it is theirs. They need to know what they're doing, when they're going to do it, and how. So those are some real things you can do in the session. Another thing you can do in the middle of your session, and I do this in mine, is you can ask, and this is helpful for self-monitoring, take a movement break. How are you feeling? Do you need to take a break? Or don't ask. And if the person's not capable of standing up and sitting down and stretching, you can like do this or a diddly do, or like some progressive muscle relaxation. You can even teach that strategy at the top of the session at the beginning, and then use it again in real time. You can teach a mindfulness strategy again, or another physical strategy, a new one each time, or the same 2 or 3, because you're then using it in the session, and you're modeling for them, this is when you can use it. And then also they can take it away with them. It's a tool.
It's interesting because I think the natural impulse for a lot of clinicians for ADHD is to have shorter time frames. And so I was really glad to hear you say like that's not necessarily
No,
what
it's
direction
contra-
to go. Yeah, there's a question in here. How would you help clients get out of a freeze trauma response as a cause for executive dysfunction in overlapping neurodivergence and CPTSD?
That's about time for today, folks. No, I'm just kidding.
I know, I was reading that and I'm going like, I would have to really yeah, I would pump this one for sure. I'd have to really think about it. And you may, want to think about it and we could share a response,
So I would say this comes up a lot, actually. I don't know if I can answer this in just a few minutes. But the question, as I'm understanding it, was, sorry, my initial panic stopped me from hearing the entire thing, is what do you do if it's a PTSD situation getting activated and then that's what stops them? I actually have clients with I have a client with severe PTSD that gets triggered when she has to do academic tasks because of something that happened in an academic environment. She even dissociates and self-injures. So I wouldn't say that that's a tips and tricks type of thing. You do that as well. But this is where it gets back to assessment. Whoever asked that question, it was really, really thoughtful. And you're going to really find out well, what's going on? This isn't just about executive functioning. You're treating the dissociation. You're treating the trauma. I would look at TF-CBT strategies. I would look at deep breathing and grounding. So 5, 4, 3, 2, 1. I know I'm answering with things I'm not going into detail on. But look at the mindfulness slide. Also, there's a DBT website, DBT tools and interventions. I can find it later that will give you specific strategies to try that can help in those moments. I hope that gives you something to work with.
No, that's good. And nowmattersnow.org has some good DBT
Awesome.
stuff too.
Yeah.
So between those, so we have time for one more question. Where can I find information on ADHD and hormones?
Oh, okay. That's a great question. I would start with Attitude magazine is a good resource hub for everything under the sun with ADHD. They have a lot on ADHD and hormones, ADHD and cisgendered women in general. If that's specifically what you're asking about, it's ADD and then Itude. So it's Attitude, but with ADD instead. And it's a magazine, but it's online and they have a ton of different things. So I would start there.
Yeah. So there's a couple of questions. How to provide support to our adult clients who culturally, medically, behaviorally, those nuances are not taken into consideration. They've been struggling with symptoms undiagnosed.
Yeah.
Yeah.
So that's another excellent question. How do you support your clients who don't take what into consideration?
Cultural nuances. So cultural, behavioral nuances. Yeah.
I think, again, and I don't say this as a cop-out, you want to know what they do think is going on. So if someone says, I don't have ADHD, this is happening, or maybe they have been misdiagnosed, or maybe you suspect that there's no ADHD and there is, or there is ADHD, but they don't want to talk about it. It doesn't matter. I mean, of course it matters. It definitely matters. But what matters more is the symptom, what's happening and why it's happening. If they're on medication or they don't want to take medication, that's something else you have to address with them. But either way, you can support anybody with any of these strategies, regardless of what's going on, and be culturally sensitive. That's a given, of course.
Yeah.
Really get to the clients, get to their motivation.
So, Jenny, I'm going to echo one of the comments here in the chat. Thank you so much. This was amazing.
Oh, sure.
I agree. And, you are incredible and with so much information. And one of the things that I think I love and I know everyone appreciates is when they can leave with very concrete information and tips about what to do even, right afterwards. And so thank you so much for taking your time and sharing and being just so genuine about all of your sharing. So thank you. We really appreciate you.
Yeah, this was a pleasure.
I wish everyone a wonderful day. Thank you for joining us and take care, everyone.
Great. Happy functioning.